According to a recent survey by Public Health England, it was found that adults over 50 in the South East are more likely to encourage others to see the doctor than go themselves. And this is why a roadshow has been travelling around the region this week to help more people be more clear on cancer and spot the warning signs earlier. Our reporter Richard Stringer found out more in Havant.
Have you had a cough for 3 weeks or more? And do you get tired out by simple tasks that used to be easy? Well, it could just be that you're getting older, or it could be the early signs of lung cancer. Either way, Public Health England, along with the Hampshire and Isle of Wight NHS Trust, are urging people to see their GP in a new campaign, Be Clear on Cancer.
This campaign is a collaboration between Public Health England, who I work for, Department of Health, NHS England, and really the idea is to get people to come forward when they have symptoms so that we can pick up problems early. It really matters because breathlessness and cough, they relate to lung conditions, heart conditions, and lung cancer even. So it's really important to get it checked out. In 2015, there were 37,600 people diagnosed with lung cancer. Now, when it's picked up early, 83% of people have a 1-year survival. When it's picked up at stage 4, which is when it's become big and spread and it's really ugly, at that stage, that survival comes down to 17%.
As well as the coughing and breathlessness, are there any other symptoms that we should be aware of?
Coughing up blood, unexplained weight loss, feeling really tired for no apparent reason. What we're focusing on is breathlessness, and that's breathlessness doing stuff that is usual. So for instance, mowing the lawn, getting up from the sofa, climbing up a short flight of stairs, that should be checked out, and coughing that's persistent over 3 weeks. So that needs to be checked out.
The campaign isn't only being backed by medical professionals, but cancer survivors as well.
So I was approached by Public Health England if I would help the campaign, as I also suffer with COPD, which is commonly known as chronic obstructive pulmonary disease, and I also have lung cancer, of which I've had an operation for, and that was just over 2 years ago. I didn't need no further treatment, and so at the end of the day, if you like, I'm a survivor. I was in denial when I first had COPD, and thanks to my wife who phoned for an ambulance, they took me in the hospital, and I was lucky to make it then. And so I vowed and declared that I would do something to help myself. People are not clear about their condition. They tend to shy away from it. And what they need to do is go and seek the help and advice from their doctor, especially if they've got a cough. It may be COPD, or it could be something innocent like, I don't know, Febrile asthma or something. It can also be signs of lung cancer, because lung cancer and COPD are very similar. But at the end of the day, they should still visit their GP.
Eric says part of what helped his recovery is that he's so active and regularly clocks up more than 30,000 steps a day.
It was important to be active. I need to build up the muscles in the thighs, calves, and in the biceps, all to help me breathe, because that helps to store the oxygen. So I do at least 10,000 steps before my breakfast. And then later on I'll do more steps and so forth, and build it up till at the end of the day I do 30,000.
And really would encourage people, particularly those over 50, if they've got these symptoms, or if you know someone who's got these symptoms, encourage them to get it checked out early.
This is Richard Stringer for That's TV.